You're sad, so you must need a medication for depression. Nobody's looking at the 10 other causes of depression, hormones, nutrition, environment, trauma. So what is really the foundation of functional medicine is focusing on kind of the same medical model we use if we have a headache or chest pain. We do objective tests. Traditional psychiatry does not do any objective tests. It's just an educated guessing game.
Welcome to the Mindfulness Experience Podcast, where we explore different approaches to wellness and mental health. Today, we are thrilled to have a true pioneer in the field of functional and integrative psychiatry, Dr. James Greenblatt. He's a medical doctor, and his work focuses on biological and nutritional factors that play a role in mental health. He's also a leading expert on personalized medicine for mental illness. Dr. Greenblatt is speaking at the Wonderland Conference, and today we'll talk about that and his work with key biological and nutritional contributions or contributors to mental health. We'll explore the importance of optimizing biochemical health prior to the initiation of psychedelic-based therapies and how it can enhance neurotransmitter production, neuroplasticity, and other systems and pathways that support balanced brain function. Welcome to the Mindfulness Experience Podcast, Dr. Greenblatt. How are you today?
I'm doing well. It's good to be with you and join you on this really important series.
Well, I am really grateful. I know that you've got lots of things happening. You're helping a lot of people, and I also am aware that you're the chief medical officer at the Walden Behavioral Care Facility. I'm wondering, when we start looking at your bio, and we start talking about functional medicine, can you describe the differences between traditional psychiatric care and functional and integrative psychiatry, and why the latter should really be considered as a better approach?
Sure. I mean, I think our current model in psychiatry, evolved over the last half a century, is, pretty simplistic model of an evaluation and a diagnosis based on symptoms and a treatment with medication. I mean, really, it's medication and therapy. The last 40 years, we've been consumed with a pill. And not that medications are bad or not necessarily helpful, but we have 25 years of research demonstrating medications are limited in its efficacy. Only 50, 60% get better, and relapse rates are high, and we all know the story of the crisis. So the current model is very simplistic, symptomatic based, and a functional model looks at, are there other underlying contributing causes, environment, nutrition, genetics? The list is endless, but it focuses on underlying causes.
So you're really taking into account the whole person, their environment, the psychosocial model, and or the biopsychosocial model, and you're really taking into account what are the contributing factors, whereas maybe the old psychiatric model is really very Freudian based and really doesn't take into account some of the more underlying factors that might be driving the illness or the dis-ease. Is that true? Am I speaking clearly?
Partly, but I think what's happened is we've shifted from the Freudian, the psychology, to this just biological based symptomatic treatment. You're sad, so you must need a medication for depression. Nobody's looking at the 10 other causes of depression, hormones, nutrition, environment, trauma. So what is really the foundation of functional medicine is focusing on kind of the same medical model we use if we have a headache or chest pain. We do objective tests. Traditional psychiatry does not do any objective tests. It's just an educated guessing game.
Mm. So this really goes beyond, talk therapy or really, tell me about your relationship with your mother or father. I mean, you're really getting into what are all of the contributing factors for that particular individual, not only based on their story, but what's going on inside of them. And I know that you talk about nutrition. I'm wondering what role does nutrition play in mental health, and how can we use it to improve, some of the outcomes for ourselves, or how do you use it in working with patients?
I think it's one of the most critical neglected factors in our field of mental health. We're aware of, the obesity epidemic, if you will, the ultra processed foods we're feeding our kids. The brain is the most metabolically active organ in the body, and nutritional deficiencies affect mood and behavior. And this, we just have neglected from our treatment model. And I think it's just a critical factor. Sometimes the difference between someone getting better with depression or anxiety and someone staying ill.
So really the whole area of the gut biomes and the whole area of really eating whole foods, or really helping the individual to feel whole and complete in that respect. That's a key factor that you look at. I'm wondering, from your view, you've talked extensively about the importance of optimizing biochemical health prior to initiation of psychedelic-based therapies. And I know you're talking at Wonderland. Perhaps you're going to be talking something or bringing that into the conversation. Can you explain this a little bit more in detail?
Yeah, sure. As much as I've been excited about some of the new both technology and the research in psychedelics, I work in a hospital where we get patients who have failed multiple treatments. So they're in an inpatient psychiatric hospital, and many have had psychedelics, and it didn't help. And my world of functional medicine, we're always looking at why. And we found some of these nutritional deficiencies. We found some of these gut problems. And when we treat those, then psychedelics might provide a more robust response. So I'm really trying to combine these worlds of functional medicine with the excitement around psychedelic medications.
Mm-hmm. And I certainly don't want you to give, your whole discussion or what you'll be talking about at Wonderland, but will that be the topic, or will you be diving into other areas as well?
No, that's the topic. How can we improve outcomes, and with psychedelics? And it's a merger of this field of functional medicine. I mean, we all tend to look for that, magic bullet. And, it's just not going to happen. The brain is too complicated. So medicines might be helpful, psychedelics might be helpful, but for some individuals, B12 might be the most important intervention because they have a autoimmune disorder that affects their ability to absorb this vitamin.
So is B12 a standout? Is that why you bring it up? Or I'd like to understand that for myself.
Sure. Yeah. It's a common nutritional deficiency. I see it more in our vegan population. So that's why it's been concerning, and it has profound effects on mental health, anxiety, depression, early cognitive decline. It's a simple test and a simple treatment. And, we have hundreds of those kind of biomarkers that we look at when we talk about functional medicine.
Well, as a vegan, vegetarian for 25 years, vegan for the last 4, I'm very interested in pursuing that discussion a lot more, and I'd like to, certainly attend your event, or certainly attend your talk, but I'd like to dive into that a little bit more. When you start taking a look at mental health and mental health care evolving, what role do personalized approaches play in the evolution? In other words, when I go in, if I was working with you or look to go ahead and set up an appointment with you, what would be kind of the process of really understanding me and my own gut biomes and my own physiology and biology and neurology?
Yeah, a very important question. I mean, I think the first step, particularly as a consultant seeing patients who haven't gotten better, is just making sure that they have hope, because I think the process of mental health treatment has been frustrating for so many. So that hope starts with, I'm going to look at everything I can of what's going on for you. I don't know yet, but I'm going to work as a detective, and we're going to look at nutrient levels. We're going to look at environment. We're going to look at your gut microbiome. We're going to do lots of these tests. So it starts, to answer your question, with objective testing. And then hopefully I'll be able to share with you that some of the issues affecting your symptoms are related to your gut. Some are related to a nutritional deficiency. Some might be related to an abnormal hormone imbalance. We don't know, but everyone's different. And that's the personalized medicine approach that's really lacking in our traditional psychiatry model.
So that's absolutely wonderful. So you're really taking a real whole approach, looking at, again, the biopsychosocial, the elements of what I'm bringing into my eyes, my ears, my nose, my mouth, and how I'm digesting, and what are the signs and symptoms. And as a detective, then you're formulating your approach to what the overall regime might be. Is that right?
Yeah, no, absolutely. I mean, our medical model, if you and I had a let's just say, a headache, a severe headache, we're not just going to give you a pill. We're going to test. Is it a brain tumor? Is it migraine? Is it this? I mean, what's going on? What's contributing? And that's our medical model. But psychiatry just misses that, and they just treat symptoms. Everybody who's depressed, whether it's due to cancer or a thyroid imbalance, you're going to get this antidepressant. And it only works 50% of the time.
Right. So it's really not treating the whole person. It's often masking the symptoms and masking the root cause. And really what I hear you saying is you're really looking as a detective and as someone who is really taking into account the whole person, going into what is the root cause and how can we solve the problem. Yeah.
Yes, absolutely.
Good. Can you share perhaps, if you will, I mean, if I don't come to you, are there some simple steps that individuals might be able to take to improve their overall mental health with nutrition or lifestyle factors, things that they can do?
Yeah, I mean, the list is long, and many patients with depression have, heard, about exercise and movement and sleep hygiene. I mean, I can't stress enough how important sleep is, and the whole foods diet and avoiding ultra processed foods. So we've all heard that, and for someone who's depressed or anxious, it might be hard following through. And that's where the testing is helpful, because I think the first steps is going to your doctor and looking at some of these very simple nutritional deficiency tests like B12, like vitamin D, that all affects brain function, and beginning to see if some of these factors are playing a role for you.
Great. That's that certainly sounds like a basic approach. Certainly the food, the exercise, and the sleep. But you're really taking it, I think, a step further, which is really taking a look at some of the basics, as you say, B12, vitamin D, and going and getting a blood test and taking a look at your nutritional profile. Can you share any success stories from your practice using a functional and integrative approach to mental health? I mean, without giving away names, obviously, we know that, right? Yeah.
Sure. Yeah. No, I've been doing this 30 years, so I could use numbers like hundreds or thousands of patients that we've treated. And I mentioned vitamin D and B12, but, there's a child we saw that had this disorder called elective mutism, didn't speak, was so anxious. And they had a vitamin D level of under 10, which is very low, 7. And vitamin D is required to make serotonin in the brain. People don't, know that. And so just an intervention of optimizing vitamin D was able to get this child, to participate in therapy and eliminate this disorder. And then I mentioned the B12. I've had hundreds of cases of a B12 deficiency. Again, some related to a vegan diet, some related to an immune disorder, some related to just poor absorption. But the symptoms mimic a major psychiatric disorder. So by just giving B12 injections, major depression gets alleviated. It often can be that simple, not always, but sometimes.
Well, I'm just wondering what my supply of B12 is as we're speaking. I want to make sure I'm in good shape on that for sure. Let me ask you, what you're doing, is really wonderful, and it's a whole functional approach as this is the area that you specialize in. But I'm really wondering, as we look at medicine, it seems to have become very specialized. It's not integrative, and it really is sort of, to the earlier point, treating the symptom, not the root cause. What can other mental health professionals or how can they incorporate, functional and integrative psychiatry into their own practices? Because I'd like to see more of this. Do you have thoughts about that in terms of your mission or the things that you're doing?
Yeah, I mean, part of our work is educating clinicians, nurse practitioners and doctors, about an integrative and functional approach. And it's really tragic how little nutrition is incorporated into any medical or mental health training.
I heard that they probably get about an hour or two in medical school. Is that true?
In terms of the clinical implications, absolutely. And in a psychiatry residency training program, even less. But things are changing. But so my focus is on educating, next generation of clinicians to be able to utilize this material. And it doesn't mean, throwing away your prescription pad. It's not alternative medicine. It really has to be understood as just good medicine. I imagine that's, challenging. And,
you must come up against some naysayers or non-believers. What challenges have you faced in promoting this approach and, looking at a more personalized or biologically informed psychiatric care model? And, how do you overcome them? And how do you deal with that?
Well, I've been, trying for 30 years. And I think what has kind of supported this work is the tremendous research. Now, you mentioned the gut microbiome, the nutritional diet, research has really just solidified what appears common sense to many of us, that, what we eat or don't eat affects mood and behavior. So the research has just made it much easier to be able to get in front of colleagues and use words like double-blind placebo-controlled trials, or the research now supports this information. And it really is just changing a culture.
Right. And that's not easy because a lot of people don't, the nature of change is challenge, and a lot of people don't like to be challenged, right?
Absolutely. I can give talks to a large audience of physicians, and many of them might take supplements, might look at, an integrative health model for themselves and ask questions about themselves or their children, but have yet been able to sit across from a patient and utilize that as part of their treatment model. That's
why is that? Is it the industrial medical model? What kind of challenges are they faced with, do you think?
I think they just don't have the training. They don't have the training, and the pharmaceutical industry is pretty impressive and powerful, and that's the research that is being they're exposed to, and nobody is educating them, certainly not in their required training, on the role of nutrition or environment and mental health.
Well, you're doing an incredible service here, and certainly given your years of background. I know that you've created this online educational platform, Psychiatry Redefined. How can that benefit clinicians as well as patients, people like myself or anyone else that might be interested in finding out a little bit more?
Yeah, psychiatryredefined.org is an educational platform set up for clinicians. So people that want the research and the information of how to treat clients. There's lots of free content available for consumers. And we're finishing up our educational program so we can just go direct to patients struggling with depression, anxiety, and ADHD. So that should be completed by the end of this year. So we can support the educational programs for clinicians, but as well as empower consumers to take control of their health and certainly their mental health.
Excellent. So that's wonderful that we'll be able to access that. And also, finally, I know you have this book series, Psychiatry Redefined, which offers accessible guidance on applying functional medicine and integrative medicine and mental health care. And you also have another book, I understand, Answers to Anorexia, and how it can advance the field. Maybe you can provide us a little bit of insight into that?
Sure. I mean, I think anorexia nervosa is neglected by our medical and psychiatric community. It has the highest mortality rate of any psychiatric illness, comparable to overdose and addiction, and the highest rate of suicide. And my day job for 20 years has been working with patients with anorexia nervosa. So the current treatment model really neglects these concepts around functional medicine and nutritional deficiencies, even though these patients have been starving for many years. So Answers to Anorexia is a summary of my 20 years in the field, trying to help patients and families understand an effective way of treating this life-threatening illness.
Wow. Well, there's so much to learn and so many opportunities to have a healthier society. I know that the Miami, Wonderland Miami 2023 conference will focus on health, wellness, longevity, and psychedelics, and you seem to be on the forefront of all of those topics. Are you excited to go there? Have you been at this event before?
No, it's my first time, and I'm just really pleased that they expanded to, broader mental health perspective, because it really, there's not one tool that's going to change and transform our current model. We're going to need to utilize many things, and it seems like the conference was able to put that together. So I'm very excited to be part of it this year.
Well, I'm incredibly excited to have you on the podcast, and I look forward to meeting you at the conference. I, again, appreciate you taking some time out of your very busy day and helping to lift up the topic. And people, if they want to find out more about you and your work, how would they go about doing that?
The psychiatryredefined.org is the professional site, and jamesgreenblattmd.com is my site with our books and educational content.
Excellent. Thank you, Dr. Greenblatt. Really appreciate it.
Thank you for having me. Take care.
Thank you so much for joining us today, Dr. Greenblatt. It's been an illuminating and inspiring conversation. If you're interested in learning more, please visit Dr. Greenblatt's website. That's www.psychiatryredefined.org. Remember to use the code Mindfulness20 to receive 20% off your registration for the Wonderland Miami 2023 conference. And as always, thank you for listening to the Mindfulness Experience Podcast. We'll see you next time.